Chapter 17a, Sexually Transmitted Diseases and AIDS. It's estimated that approximately 19 million infections occur in the United States per year for sexually transmitted diseases. 2/3 infected in the United States are less than 25 years old, and the treatment costs for sexually transmitted diseases cost billions of dollars per year. The reports are most common among individuals ages 14 to 26. Estimates also include that 26% of females ages 14 to 19 have had at least one sexually transmitted diseases, and 15% more than one. Estimates also include that 20.1% females with one lifetime partner have contacted one sexually transmitted disease. 50% or more with 3 or more partners has contacted a sexually transmitted disease, and the most common is human papilloma virus. Sexually transmitted diseases, of course, are transmitted by sexual contact, and it can either be caused by bacteria or viruses. Bacteria are treated with antibiotics, whereas viruses are treated with antiviral drugs. Sexually transmitted diseases are not routinely tested for during physical examinations. They have more severe consequences for women than for men, such as sterility, ectopic pregnancy, or cervical cancer. So STDs have more severe consequences for women, and they are not tested for during routine physical examinations. The challenges of sexually transmitted diseases is that they often have no symptoms, so people are unaware that they are infected. In many areas, this has prompted the use of sexually transmitted infection rather than disease, since people don't have any symptoms. Symptoms can disappear without treatment, leading a person to mistakenly believe that he or she might be cured. Sexually transmitted diseases caused by bacteria include chlamydia, gonorrhea, and syphilis. And these three, since they are bacterial, can be cured with antibiotics. This just shows a population, graph of population per thousand and of the years. And syphilis reached its lowest point in 2000. Since then, it's begun to rise slightly, primarily among the homosexual community. Chlamydia is the most frequently reported infectious disease in the United States, caused by the bacterium Chlamydia trachomatis. It cannot grow outside a human cell and infects the mucous membranes, and mucous membranes line every opening to the outside of the body. It is highly contagious. Individuals either it does not cause noticeable symptoms that would prompt that individual to seek treatment, or they may not have any symptoms at all. Symptoms might take weeks or months to appear, but chlamydia can be passed to others. Symptoms in men includes inflammation of the urethra caused by burning sensation upon urination. In women, pelvic inflammatory disease may cause pain in the abdomen and lower back, abnormal vaginal discharge, bleeding, or pain during intercourse. Long-term consequences of untreated chlamydial infection include in men sterility, resulting from if infection scars the vas deferens, delivering the sperm. In women, can also cause sterility if infection scars the oviducts. If the oviducts becomes only partially blocked and fertilization occurs, then ectopic pregnancy may result. Chlamydial infection in pregnancy. It can cause the protective membranes around the fetus to rupture, killing the fetus, and can be transferred to a fetus at birth. Newborns are typically treated with a solution, a drop of silver nitrate to the eyes. Chlamydial infection, the diagnosis can be from urine tests looking for the DNA of the bacteria, and again, since it is bacteria, it can be treated with antibiotics. Gonorrhea is caused by the bacteria Neisseria gonorrhoeae, which again infects the mucous membranes lining ever service to the exterior of the body. It's generally transferred when an infected mucous membrane directly contacts another mucous membrane. The symptoms are similar to those of chlamydia. In men, inflammation of the urethra causing a burning sensation during urination, as well as may cause a discharge to occur from the urethra. In women, can lead to pelvic inflammatory disease of abdominal pain or lower back pain. Long-term consequences of untreated gonorrhea are same as those of chlamydia. In men, sterility can result if infection scars the vas deferens. In women, sterility can result if infection scars the oviducts. Again, if the oviduct is only partially blocked and fertilization occurs, then an ectopic pregnancy can result. And so this just shows the complete blockage of one of the oviducts by scar tissue, which causes infertility. Complete blockage of both oviducts causes sterility, because we ovulate out of one ovary every other month. Partial blockage reduces fertility, and it increases the risk of ectopic pregnancy, because it should be in the endometrium where implantation occurs. Gonorrhea diagnosis, again, is either used to detect the DNA of the bacteria, or either examine a smear of cells that could be taken from the infected area. Treatment in the past was antibiotics were used, and it was easily cured. However, now today some strains have become drug resistant. Syphilis is caused by the bacteria Treponema pallidum, and the syphilis always produces symptoms. It's going to go through different stages, but syphilis always produces symptoms. Its route of entry is that it can invade any mucous membrane. It can also enter through a break in the skin, and syphilis can cross the placenta and infect a growing fetus. The bacteria are extremely delicate and cannot survive drying or even minor temperature changes. If untreated, syphilis progresses through 3 stages: canker stage, rash, and a gumma stage. The first stage of syphilis, a canker forms at the site of the contact. A canker is just a hard, painless crater-shaped bump at the place where the bacteria entered, usually in the genital area. It may not always be noticed, sometimes mistaken for something else, or it may be an area that's not readily detected. Cankers last only 1 to a few weeks, during which time it ulcerates, becomes crusties, and then will disappear. At this point, can be diagnosed from identifying from the canker stage, can identify the bacterium in a discharge, and can be treated with antibiotics. The second stage of syphilis is characterized by a reddish-brown rash that covers the entire body. It does not hurt or itch, and each bump breaks open, ooze fluid, and becomes crusty. This ooze contains millions of bacteria. The disease becomes increasingly difficult to treat as it progresses through these stages. Symptoms can go away, treated or untreated, and some individuals have periodic symptoms and others have possibly no outward signs for years. Again, can use a blood test to detect the antibodies that the individual has begun to produce against this bacterium, and can be, since it's bacteria, can be treated with antibiotics. The third stage is the lesions or the gummies appear on the skin or internal organs, including the aorta, which is the major artery leading away from the heart. If it's on an artery, the arterial wall can weaken and bust, causing the person to bleed to death internally. Can also go to the optic nerve, which can lead to blindness. Treatment at this stage is very difficult, and it requires massive doses of antibiotics over a very prolonged period of time. The damage that's already been done to the individual's body cannot be repaired. It still can be treated, but any damage to the nervous system, such as paralysis, insanity, or blindness, cannot be repaired. And this just shows the different canker, the rash, and the lesions or the gummy stages of syphilis.